Malnutrition and rising prevalence of non-communicable diseases such as hypertension and cardiovascular diseases have been described as Nigeria's current health burden. A significant contributor to these health problems, the Coalition for Salt Reduction in Nigeria says, is the excessive consumption of sodium, primarily through processed and packaged foods, including widely used seasonings like bouillon cubes and monosodium glutamate (MSG). The social media in recent times have been awash with reports of Nigerians, big and small, who slumped and died without prior notice of ill health, which the group linked to poor cardiovascular health, resulting from loopholes in existing food safety policies and regulatory mechanisms that have greatly impacted the quality of food produced, marketed, and consumed by the populace. In a press briefing tagged Bullion Fortification, Public Health versus Profit, the group gave reasons as to why government should jettison plans of fortifying bullion cubes. According to the Executive Director of Corporate Accountability and Public Participation Africa (CAPA), Akimbode Oluwafemi, the consideration of fortifying bullion cubes as a food vehicle for delivering iron and zinc to households in order to combat micronutrient deficiencies in Nigeria is a bad idea owing to its high sodium content. He said selection of bullion cubes defies one of WHO's criteria for food vehicle selection, which states that a suitable food vehicle must not pose a threat to public health.
Nigeria needs to look for healthier alternatives, and all these ultra-processed, food, ultra-processed seasonings are not healthy alternatives for Nigeria. The government should look at vehicles, if it must fortify, that will not lead to increase in sodium consumption, or of food vehicles that will have, public health consequences.
And that sodium has been shown to be injurious to health in high concentrations. And now these bullion cubes that in and of themselves could pose a significant health risk are now being proposed to be used as an official vehicle to enhance food fortification, which is used as a vehicle to deliver micronutrients like vitamins, like iron, like iodine, and those things that in certain populations and underserved groups could also pose them to additional health risk.
We plan to work with government to implement advertisement and marketing restrictions for high sodium foods. A lot of these industries are targeting vulnerable populations like school children with unhealthy food products. Before now, disease conditions like hypertension, cardiovascular disease, stroke, kidney failure was prevalent among the older generation. But now you have children getting down with hypertension, with stroke. So that's alarming.
Resulting from the fortification of salt with iodine, Nigeria presently records an average daily salt consumption of up to 10 grams per day, exceeding the World Health Organization's recommended limit of 2 grams, less than 5 grams of sodium per day, which is equivalent to 1 teaspoon of salt daily. In Abuja, Princess Ekwi Ajude reporting.